Welcome to Renal Care Radio, exploring a broad spectrum of topics in the field of nephrology. Renal Replacement Therapy, RRT, represents a critical intervention in the management of acute kidney injury and chronic kidney disease, offering life-sustaining treatment for patients experiencing severe renal dysfunction. Determining the optimal timing for initiating RRT is complex and depends on various clinical factors. This episode explores the considerations for starting RRT, including the impact of timing on patient outcomes, the physiological indicators necessitating its commencement, and the different modalities of RRT available. The decision to initiate RRT is guided by specific clinical indicators of kidney failure, including uremia, fluid overload unresponsive to diuretics, severe electrolyte imbalances, and acid-base disturbances that are refractory to medical treatment. Traditionally, RRT was initiated early in the course of renal dysfunction to preempt the onset of these complications. However, recent studies suggest that the timing should be carefully weighed against potential risks such as infections, vascular access complications, and the physiological burden of dialysis itself, especially in fragile patients. The timing of RRT initiation remains a subject of ongoing debate within the nephrology community. Early initiation, often defined as starting RRT before life-threatening symptoms develop, is theorized to reduce the burden of toxins and manage fluid status proactively. Conversely, late initiation, typically reserved until traditional indicators such as severe azotemia or oliguria manifest, may benefit patients by avoiding unnecessary RRT in cases where renal function recovers spontaneously. The initiation of dialysis early versus delayed in the intensive care unit study, also known as IDEAL-ICU, and the artificial kidney initiation in kidney injury trial, are two pivotal studies that have investigated this aspect. Both studies have examined the various aspects of an early strategy in terms of recovery and length of hospital stay. The choice of RRT modality, that is, hemodialysis, peritoneal dialysis, or continuous renal replacement therapy, can also influence the decision on when to initiate therapy. CRRT, for example, is preferred in hemodynamically unstable patients due to its slower and more continuous solute and fluid removal, which offers a gentler alternative to the rapid shifts associated with intermittent hemodialysis. This modality allows for greater flexibility in managing critically ill patients, potentially supporting a slightly earlier initiation in those who are unstable. The decision to initiate renal replacement therapy is a critical component of managing severe renal dysfunction, with timing being a key factor that impacts patient outcomes. While early initiation may prevent the onset of severe complications, it is not universally beneficial and must be tailored to individual patient conditions and responses. By carefully considering the type of RRT, the patient's overall health, and the progression of renal dysfunction, healthcare providers can make informed decisions that balance the benefits and risks of early versus late initiation of renal replacement therapy. Thank you again for joining us here on Renal Care Radio.